welcome to tonight's webinar. Everybody just joining us. This is Attention Please, an expert session in all things ADHD. Now, we are thrilled to be hosting during ADHD Awareness Week, and allow me to now introduce you to Heidi Reinhardt, who puts the expert in our expert session. Heidi, we have you on the line here?
Yes, good evening, everyone.
Perfect. So Heidi comes to us from CADDAC, and that's the Center for ADHD Awareness Canada. Now, she experiences and interacts with others diagnosed with ADHD on a daily basis, not just at work, but as a mother of 3 young men with ADHD. Now, Heidi is a psychiatric nurse by training and the founder, president, and executive director of the Center for ADHD Awareness Canada, which you'll often hear referred in this presentation to as CADDAC. And it's a national not-for-profit organization dedicated to awareness, education, and advocacy for ADHD. Now, Heidi also served as the executive director of the Canadian ADHD Resource Alliance, a national not-for-profit organization of the leading clinicians and researchers in ADHD in Canada for 6 years. And now, over the past 18 years, Heidi has helped raise awareness and understanding of ADHD amongst parents, educators, healthcare professionals, industry leaders, and government officials through presentations like these, conferences, media interviews, and other advocacy work. So Heidi, we are so honored to have you extending your efforts now for ADHD awareness to our audience this evening. And at this point, I will allow you to take it away with your full presentation.
Thank you very much, Reagan. Okay, so let's start. I'm going to do a very quick overview just to let you know what's coming. So we're going to be talking about what ADHD is and what it is not. We're going to clear up a few misconceptions. We're going to talk about symptoms and how these symptoms can also appear to others or be misinterpreted by others. We're going to talk about the 3 subtypes of ADHD and do a little overview of coexisting disorders that frequently come with ADHD. And lastly, we're going to be talking about social emotional impairments that frequently come along with ADHD as well. So let's get started. I want to let you know right off the top, this is an overview of ADHD. Obviously, this is a very, very complex disorder, so to cover it totally, we would probably need a full day, but hopefully you'll learn quite a bit this evening. So this is just a slide about who the CADDAC is, Center for ADHD Awareness. We're a national not-for-profit organization. And we do leadership in awareness, education, and advocacy for ADHD, and our members are made up of individuals as well as ADHD organizations across Canada. So these are a few simple points about ADHD. Some of these are also highlighted in our Awareness Week key messages. So ADHD is the most common childhood mental health disorder in Canada. So it is very common. It doesn't discriminate. It impacts people from all walks of life, ethnicity, backgrounds, and we see it worldwide. It affects more than 1 million Canadians of all ages. It can impact someone's learning, their work, their relationships in family, their marriages, all types of relationships, and it really impacts almost all areas of an individual's life. It is very real. I think that's probably our most important message. This is a very real disorder, even though sometimes in the media that's still questioned. And although sometimes it can be quite easy to diagnose, it should never be a 15-minute physician appointment because sometimes it can be quite complex to diagnose. When we're assessing for ADHD, it is as much ruling in the symptoms for ADHD as it is ruling out any other disorder that could be mimicking those symptoms. And we're talking about physical, medical physical disorders or any type of mental health disorders. So let's look a little bit at what ADHD is not, and there's so much misinformation and stigma surrounding ADHD still that We find very often it's easier to deal with those myths right up front and at the same time give you the correct information. So ADHD is not a new fad diagnosis of the 20th century. It was first written about by a Scottish physician by the name of Dr. Alexander Crichton in 1798, and he actually described a lot of the symptoms quite accurately. He talked about this mental restlessness that he saw in some children. ADHD is not usually outgrown. We know that at least 2/3 of children who are diagnosed with ADHD still have impairing symptoms in adulthood. Not all adults may still reach the criteria for a diagnosis, but they still have many of the impairing symptoms. And actually in the new DSM-5, the number of symptoms that adults need to be diagnosed was reduced because the leading world clinicians recognize this. There are certain symptoms that decrease, like hyperactivity in adulthood, but the difficulty with attention generally remains. So ADHD is not just for boys, although we do still diagnose 3 boys to 1 girl. In adulthood, it's more 50-50. So that is telling us something very interesting, because ADHD is hereditary. You're generally born with it. We know we're missing diagnosing the girls. And the reason why this is because more often than not always, but more often than not, girls tend to have the subtype of ADHD where that hyperactivity and impulsivity is not evident. They're what we call primarily inattentive subtype. This means they're not the annoying, running around the classroom, climbing on furniture, interrupting people constantly type of behavior that we generally imagine ADHD primarily to be. So a lot of these girls are missed, unfortunately. So we do know in Canada that we are still underdiagnosing and undertreating ADHD. And we generally quote worldwide stats because we do a very poor job of researching ADHD in Canada. The last incident study that is generally referred to is from 1989 from Ontario. That is pretty ancient. So worldwide, the most conservative numbers are 5% of children and 4% of adults. So ADHD is also not caused or impacted by diet, and I think this is the biggest myth I have to correct constantly. Very much so for educators who strongly believe a lot of this is caused by too much sugar. We do know that too much sugar, too much yeast, or food additives does not cause ADHD. This has been disproven. This theory that came out in the 1970s has been disproven over and over and over again in the last several decades. But what is interesting to note is that there's a small percentage of kids, it's estimated about 5%, who do have sensitivities to food dyes and additives. For those children, food dyes and additives will increase their hyperactivity. But note, hyperactivity is not ADHD. It's a symptom of ADHD, but it's not ADHD. So food dyes and additives do not cause or make ADHD worse. It just will increase hyperactivity. And what I say to parents is if your child has just downed a gallon of Kool-Aid and is running around the room like crazy, don't give them Kool-Aid. But it won't cause or cure their ADHD to change their diet. So ADHD is not due to bad parenting. It's not due to lack of discipline. It's also not due to lazy educators. And we hear this from a lot of different areas. The parents will say the teacher just doesn't understand my child, and the teachers will say, well, the parents just aren't disciplining their kids. What we know is these children are a challenge to everyone. And to be fair to both parents and educators, there isn't a lot of awareness or education done on ADHD. I was just told that after many years of advocating at OISE, the educators are actually getting a half an hour of information on ADHD. So that is the amount of training that the regular classroom teacher will be receiving on ADHD. A little different for special ed teachers, but not a great deal more. So we know it's not too much TV or computer time. We know it's not a lack of willpower, laziness, or lack of morality in the child or adult. It's definitely not a lack of intelligence. ADHD has nothing to do with IQ, more or less. I actually presented to 4 times to a school board of children on Tuesday, and had to convince them that ADHD didn't actually make you smarter. I kind of burst their bubble. So people with ADHD have the same range of intelligence of everyone else, but it doesn't mean also that people with ADHD can't be very brilliant and on the high end of the spectrum, even if they don't do well at school. And it's definitely not just a North American lifestyle thing. We see ADHD worldwide. So what causes ADHD? Unfortunately, we don't know yet. We do know there's a strong genetic component. It's on the same level of hereditary as height. So when we look at different conditions, we rate their level of hereditary on a scale. So height and ADHD at around the 75th percentile. And you know, when you have parents who are very tall or very short, there's a very good chance that their children are going to be tall or short as well. So it's about the same rate for ADHD. We used to think that there were certain genes that were indicated in ADHD, particularly dopamine genes. Unfortunately, this has not been able to be proven. And what is thought now is that ADHD is just so diverse and complex that we can't find just a few genes that point to ADHD. So unfortunately, there's going to have to be a lot more research done on this. So there is a very small percentage of people who have what we call secondary ADHD that's due to some type of brain trauma. It can be a traumatic brain injury like a car accident, or it could also be brain injury caused by birth, lack of oxygen, that type of thing. So let's have a look at the core symptoms of ADHD, and obviously attention is part of this. But what's really interesting to know for most people is that ADHD is not just inattention. It's difficulty regulating attention. So people with ADHD and children with ADHD can underfocus and overfocus. They can have just as much trouble breaking their focus when they're overfocused. And what are the type of things they overfocus on? Well, they're things that are very highly stimulating, give them immediate feedback, things like computer games, TV, texting, all that type of thing. And a lot of these kids can spend hours and hours and hours doing this and have no concept of time passing at all. They also have difficulty prioritizing their focus. So while they may know that they should be paying attention to the teacher, their brain is paying attention to the other student behind them moving their chair and somebody walking in the hall. So they have great difficulty prioritizing and breaking their focus, even if they know something else is more important for them to pay attention to. And switching their focus for some of these people can be almost painful. And of course, what do we ask kids to do all day at school is switch focus. We ask them to become focused on doing, say, math, you know, we're doing math, we're doing a lesson, you have to focus, do your questions. Now stop focusing on that, switch your focus, and we are now going to do a different subject. And this is very tiring and exhausting for a lot of these kids. The other two symptoms, a little easier somewhat to understand: increased hyperactivity and increased impulsivity. And we're going to be talking about these symptoms a little bit more in greater detail. So what designates the three subtypes of ADHD is it depends on which symptoms are portrayed. So what's called primarily inattentive subtype, which used to be called ADD, which we no longer do, it's all called ADHD with these three subtypes. This subtype is just difficulty regulating attention. You don't see much hyperactivity or impulsivity with this subtype of ADHD. The primarily hyperactive subtype of ADHD is very rare. It's so rare most clinicians I speak to have never seen it. So it's not really one that we talk about a lot. The combined subtype, which includes all three of the symptoms, is the most common subtype of ADHD. One of the other symptoms that frequently doesn't get talked about when we talk about the three core symptoms is the difficulty with emotional regulation. In the past few years, it has actually come to the forefront. There are a lot of leading experts like Dr. Russell Barkley presenting on emotional regulation. And actually, Dr. Barkley says one of the reasons it wasn't put into the DSM stands for Diagnostic Statistical Manual. It is the Bible, per se, of the leading medical experts or medical experts, period, in ADHD or any mental health disorder, actually. So it wasn't included in there with the three core symptoms because we haven't found a way to actually put it on a scale or to actually assess how much difficulty there is in emotional regulation. With hyperactivity, impulsivity, and difficulty with inattention, we have rating scales that we can use. It's a little more difficult with emotional regulation, but it's very important to know that this is one of the symptoms that almost always comes with ADHD. Children and adults are more easily frustrated. Once they are frustrated, it's much harder for them to cope with the frustration. The other things that frequently come with ADHD are executive functioning impairment. I like to refer to it as the hidden learning disability because it impacts these children right across the board in all their learning and actually their regulation of self-management. And we are going to be talking about executive functioning impairment, which includes things like organizational skills, time management, hindsight, foresight, social skills in the second part of this presentation that's going to happen in November. Also, these kids have great difficulty with social cues and social skills, and for a lot of these kids, we have to actively teach them social skills, which is not something we generally do or most people don't do in any cultures, but it is often a necessity with these kids. So let's look a little bit more at the symptoms. This is the DSM-4 criteria. We actually now have DSM-5, but the criteria really hasn't changed. And DSM-5 actually just came out a few months ago. So these symptoms are frequently what we see when someone has an impairment with attention. They have difficulty paying close attention to detail. They can't sustain their attention for any great length of time. To people who are talking to them, it looks like they're not listening. Things that are going on in the background captures their attention a lot, and they lose their focus. They don't look at the speaker anymore. They have great difficulty following through with instructions, especially when they're list of instructions. So if you're telling a child with ADHD to do more than one or two things at a time, you're going to lose them. So if you tell them to go upstairs, brush their teeth, make their bed, grab their backpack, put their homework in it, and bring it down, you've lost them at go upstairs, and you're lucky if you get the brush your teeth. So we have to be very cognizant when we are giving instructions to kids and even adults with ADHD that this is a real impairment for them. They have great difficulty with organizing tasks and activities. And as I mentioned before, sustained mental effort is very difficult and tiring, so they will frequently avoid those type of activities. People with ADHD frequently lose things for their activities. They misplace them. They don't remember where they are. They're easily distracted, and they're very forgetful of daily activities and routines. So a child in a classroom with 30 other students, those students by end of September will probably have picked up the routine of the day, the different days in the week, what happens every day very easily. The child with ADHD, it will take a lot longer, if ever. So we frequently say to teachers, if you can have something constantly posted up on the board, either written or in colorful bristle board or whatever, that lists these so students can frequently refer to them, it's great. And actually, even in the home, having notes everywhere on back of bedroom door, bathroom mirror, on the different steps of hygiene, what the child needs to remember, you know, in the morning going out the door, these things are really, really helpful. So for people who don't understand ADHD and people with ADHD, these symptoms can be misinterpreted, and the child or adult is frequently mislabeled as being unmotivated, uncaring, not very bright, lazy, defiant, uninterested. And unfortunately, ADHD comes with a lot of stigma and misunderstanding. So a lot of these labels can be very hurtful. So let's look at the criteria for hyperactivity and impulsivity. These symptoms are a little more easy to understand. I think most people relate to the hyperactive child with ADHD running around the classroom, climbing on things, inappropriately moving around when they're not supposed to be, when they're supposed to be sitting quietly and playing quietly. So they're frequently appear like they're being driven by a motor. They're always go, 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 go. Talking excessively can also be a symptom. Frequently, these are the chatty Cathy little girls that we see in class that just can't stop talking. They may be less physical movement, but their hyperactivity comes out in their excessive talking. With the impulsivity, we frequently see this with blurting out answers, answering questions before the question is actually completed, not being able to wait in line, wait their turn. Generally, impulsivity is doing things before you stop yourself to think about, what you're doing. And the impulsivity can very frequently get children in trouble at school, at home. It is something that really impacts their friendship with other children as well. It can be very annoying to other people. So these symptoms can also result in people labeling children as being an undisciplined or bad child. As I said, the behavior can frequently be annoying to others. The disruptive behavior sometimes is towards themselves, sometimes towards others, but it's not generally malicious. It's just acting before thinking. And again, that frustration frequently can also become a problem when the child is frustrated and you throw in impulsivity on top of it, which is a very bad combination for behavior problems. Unfortunately, this can result in frequent trips to the principal's office, being expelled, suspended, and sometimes we have some children who are actually on permanent expulsion from school boards, and actually some quite young kids, which is very heartbreaking. I want to talk to you a little bit about the primarily inattentive subtype of ADHD. These kids don't look like what we think about as ADHD with this hyperactivity. They're very often the little girl at the back of the class, but can also be a boy who is spaced out, very daydreamy, slower in processing information, can actually be very underactive and lethargic, slower to comprehend, but again, have that difficulty focusing and regulating attention. But what's very interesting to note is that in learning, it is the impairment with attention that causes the difficulty in learning. As Rosemary Tannick frequently says, who used to be the research chair at OISE, a child with ADHD can give you the right answer to their question, whether they're sitting on a chair backwards or have crawled under the table or standing on top of the desk. The hyperactivity doesn't impair their learning. It's their attention going in and out during the day that causes the biggest problem. So these are the kids who aren't disruptive or impulsive. These are the kids who can be very spaced out and lethargic, but these are the kids we frequently do not pick up and misdiagnose until sometimes they're older. And I always remember Dr. Turgai in a presentation he did for us many years ago where he said we frequently pick up these girls at their first suicide attempt, which is very upsetting to know. So talking about some of these comorbid, which comorbid is a terrible term, but it just means coexisting disorders that come with ADHD. I just mentioned depression. So anxiety and mood disorders are very, very frequent with ADHD, especially in the primarily inattentive subtype. So I'm not going to read all of these. You can just have a look at the slide. But these are disorders that frequently come with ADHD. You'll notice the ones that are very high are oppositional defiant disorder. We'll talk a little bit about that in a future slide. And written language expression is very often a big difficulty for these kids. So social emotional impairment is often very, well, obviously it's very linked to this difficulty with mood regulation. As I mentioned before, these kids become more frustrated easily, but they have this double whammy that when they become frustrated, they're less able to cope with that frustration. And I'll explain that a little bit more in an upcoming slide. So a lot of people say kids with ADHD overreact, they're dramatic. But actually what they do is they react to the degree that they feel whatever is happening. They tend to feel things to a much greater degree. So they're not trying to be dramatic. It really impacts them greatly. They're more irritable. They're more moody and impulsive. And this problem with the depression is also very linked with increased suicidal ideation and attempts, which we a lot in adolescents with ADHD. They frequently miss those social cues and skills. It can be a great problem, and because of that, they have problems maintaining and making and sustaining friendships, and because of that, they're frequently drawn to the less desirable peer groups. So one of the good things to do with kids with ADHD and adolescents is to get them in some type of activity, sport, music, anything they're interested in, art, chess, anything where they can build friendships with other kids who have the same interests. And sometimes we have to actually work to manufacture these friendships for the kids, but these social skills are very, very important for them to learn. So the emotional and self-regulation component, as I mentioned, is a deficit that comes with the other symptoms of ADHD. And this difficulty in regulation can also be traced back to 1798. So motivation, which can be a big problem with ADHD, interestingly enough, is also managed by emotional regulation. Something very interesting to note, where we looked at the 40 to 60% of children with ADHD also have ODD, which stands for oppositional defiant disorder. Most of the leading experts now believe that ADHD actually sets up a child to have ODD. The interesting thing is, in some studies that have been done for oppositional defiant disorder, actually the more strict the parents are, especially if they're over strict, the greater chance the child can end up with oppositional defiant disorder. So this is definitely not caused by parents, who are too lenient. It actually has the opposite effect on many of these kids. But the one thing I'd like to say about ODD is that it's very, very important to understand this type of behavior as an impairment, rather than this is a child who's just being defiant and uncooperative. This really is a part of the disorder, and if you're interested in learning more about ODD, I suggest you pick up a couple of books by Dr. Ross Greene, Greene, out of the U.S., who wrote a book called The Explosive Child, and he's also written a book about these children with ODD in the classroom. And it's not just children with ADHD who have ODD. Most children with some type of neurobiological disorder, a lot of them have oppositional defiant disorder. So understanding it as an impairment greatly assists us in developing the proper interventions to work with these kids. I'm just going to tell you a little bit about emotional regulation and the steps to it, so we understand why this is a huge issue for kids with ADHD. So generally when something happens to upset us, say you're in a meeting with your boss makes a comment about your work that you don't like in front of all of your colleagues, and you become very agitated and maybe even angry about this. Most people can inhibit their strong emotional response, but remember, when that impulsivity kicks in, and kids with ADHD or adults with ADHD can't stop that strong emotional response enough to think about the consequences, a lot of times we have a very bad situation. So most people, when they get this strong emotional response, they do what we call self-soothe. They try to talk themselves out of it. And maybe go to their happy place in their mind, or, do some deep breathing, or try and think of why their boss might have said this. Maybe they had a bad day, or there was a misunderstanding. They try to refocus their attention so they're not sitting and seething and dwelling on it. And then they think about, okay, what am I going to do about this? Am I going to pull my boss aside after the meeting? And am I going to talk about, to them about this misinformation? How am I going to deal with this? These are all steps that all of us do totally unconsciously, but these are all steps that are extremely difficult for children and adults with ADHD. So what we know is that emotional impulsiveness results in difficulty with the emotional regulation. So now this gives us a better understanding of why these children at home, students in the classroom, children with their friends on sport teams can have great difficulty with this impulsive, reactive, emotional response that frequently gets them into trouble. So I'm just going to tell you a little bit right now about our upcoming conference, because a lot of this information is going to be dealt with in much greater detail in the conference. Just to let you know that all of our conferences are organized in a certain way that each day is geared to a specific audience. So we have a dinner and evening session for educators on ADHD and learning. We have a day for allied health and human resource personnel. Saturday, November 23rd is a full day focusing on information for parents of children and adolescents with ADHD. And November the 24th is a full day on adult ADHD for adults and their families, significant others, on adult issues for ADHD. And if any of you are interested, the information is up there on the website, which you can see at the bottom. And we have some great featured speakers this year, and you can find their bios on there as well. Since this is ADHD Awareness Week, I wanted to send you to this great resource. We've developed a website called ADHD Awareness Week website, which has lots of documents, information documents on it. But we've also just published a paper called Paying Attention to the Cost of ADHD, the Price Paid by Canadian Families, Governments, and Society. And, what I didn't cover in this presentation is the big long-term impact of ADHD, where we see that people with ADHD generally have much fewer years of education. They enter the workforce with less education. There's a lot of impact with health costs, with education costs, and this paper actually is a little depressing, I must say. I spent 2 years writing it, but it can be a little depressing to read when we look at some of the long-term impacts. And what we're trying to get is the government to actually have a look at some of the costs that they're already paying because ADHD doesn't have all the treatment and resources and awareness that it wants. So if you're interested, go to that website. There's tons of information on that website, and we're also asking people who have an interest in ADHD, specifically for Awareness Week, but this can be done all year long, is to actually contact your MPP, your MP, your local editor, your editor of your local paper. Write a letter to them and basically tell them that you are interested in ADHD, because unfortunately they're not interested in hearing about ADHD unless they think their constituents are interested in it. So that's just a bit of promotion on that. But the other resource that I would strongly suggest is the CADDAC website. We have over 30 hours of filmed presentations from last year, the last 4 years of conferences from Dr. Tannick, Dr. Barkley, Dr. Thomas Brown. These are all world-renowned presenters, and there's also filmed clips of question and answer sessions. So if you have an answer or a question, you can look it up, click on it, and you will be able to see a short video from a medical professional answering that question. There's over 300 pages of information and resources, and links on the website. It's just a plethora of information on ADHD. So I will thank you now for listening, and we'll open the floor up to some questions.
Perfect. Thank you so much, Heidi. A phenomenal presentation. There's just so much information in there. I know everybody is just still mulling over each little bit. We have tons of questions pouring in now, and I will remind the audience again, it is very helpful to ask more general questions so that they can be addressed and be very relevant to a lot of people in the audience. So Heidi, I will start you off with one. We've had somebody ask about more about the testing process for ADHD, which you had mentioned in the beginning as not just a 15-minute physician appointment. So you also mentioned that it's almost like a process of elimination of other issues as well.
Sure. So I can go through what a proper assessment for ADHD looks like. There should be a full medical history of the child or adult. There should also be a family history taken for a physical family history as well as mental health family history. There should be a very lengthy interview with the parent of the child or the adult on where the impairments seem to be occurring. Usually rating scales, or almost always rating scales, are sent home or asked to be filled in prior to the first meeting. These are things that they're papers where you actually checked off the level of the different lists of symptoms. So for children, we usually ask parents to do this. Sometimes we ask both the mother and father because sometimes the perception can be different. We also ask the teachers to fill these out because we never diagnose ADHD unless it is seen in more than one surrounding. So it has to be seen at school, at home, you know, in the sports team. If it's just in one area, then we question as to what else can be going on at that time. And we also never diagnose it unless the symptoms are at a level where they're impairing. So you need to understand that ADHD is on a continuum, so it can be very mild to very severe and anywhere in between. But, you know, all of us have those times where we have difficulty focusing and paying attention. That is not ADHD. The difficulty with focusing and paying attention needs to be 24/7. Now, it can fluctuate. Kids, their attention, or adults, can be a little bit more on one day, a little bit more off one day. It can fluctuate from hour to hour, but it is a general impairment day to day. It's not just one day because they didn't have a good day. And these are all the things that need to be teased out and looked at and at a proper medical assessment. We rule out any type of physical medical problem. These kids should have a seeing test, a hearing test. They very often psychoeducational assessment is recommended, especially if there's real impairment in learning, to see if there's learning disabilities that can be causing the problems or can coexist with the ADHD, which frequently happens. So all of these things have to be looked at and ruled in and ruled out.
Wow, okay. Yeah, definitely not a quick appointment. So it involves so much. We have quite a few audience members actually commenting on the fact that they have gone through the process or at least the initial stages of the process with their family doctors. And would you say, in your professional opinion, that if people are automatically being directed towards medication, to help to aid with the diagnosis, is medication always the answer?
Okay, so what I'll say about treatment is that treatment should never, ever, ever be just medication. Treatment for ADHD should always be multimodal. Treatment is an option. Not everyone with ADHD requires treatment. If we have a mild case of ADHD and very good classroom accommodations and strategies and parenting strategies can be put in place, sometimes that's enough. But however, if there is significant impairment with that regulation of attention, unfortunately, there isn't a whole lot that we found that really helps with that. Yes, the teacher can redirect the student if she notices the student isn't paying attention, but a lot of these kids can be looking right at you and their brain is somewhere in Hawaii. So it's very difficult to actually pick up all the times that the attention is turned off, and these kids end up with significant gaps in their learning. So there's a lot of other options for treatment, and medication should never be the first treatment and the only treatment. What we always recommend, the first thing that should be done is what we refer to as psychoeducation about ADHD, which means the caregiver, family members of the person with ADHD, and if they're old enough, the person themselves, be educated about ADHD and how it impacts them. This is a very diverse disorder. It shows up very differently in a lot of people, and it also depends on what coexisting disorders they have with ADHD, what else is going on. So it's very important to learn about ADHD and then learn specifically how ADHD impacts that person, and then we can talk about specific treatments that we think will address those specific impairments.
Absolutely. Great answer. Um, in regards to that, we have people asking as well, is there a very accurate age or a minimum age that is usually a good time to look for a diagnosis?
Yeah, actually, up until recently, it was actually specified in the DSM-4 that children had to be 6 and older to be diagnosed. But the American Pediatric Association last year just came up with newer guidelines and said, you know, if ADHD, if the symptoms are severe, a child of 4 could actually be diagnosed and given medication, but they strongly recommended that other treatments be tried first before medication is attempted, and with the hope that these other treatments could actually assist in the short term.
Okay, perfect. Now, moving on to a bit of a different topic related to ADHD. Do you find that there's been a prevalent connection to ADHD and anxiety in children?
Yes, actually, I think that came up clearly in one of the slides where we talked about coexisting disorders. Very much so in the primarily inattentive subtype of ADHD, anxiety frequently occurs with this. And we think why that is, or one of the reasons is that when people rev up their adrenaline, for anybody, not just people with ADHD, they are able to pay attention better. If you know your taxes are due the next day and you're all revved, you've got to get this done, you can actually work through the night and do it. You can't do it long term. But for a lot of these kids with ADHD and adults, they constantly rev their anxiety, to try to pay attention. Now, the anxiety can be part and parcel with ADHD, or it can be an actual separate disorder that coexists with ADHD, and that is something the expert has to tease out. But anxiety is a big issue with a lot of people with ADHD.
Okay, perfect. We'll move on to one of the next ones. Now, we actually have somebody in the audience. This one sounds a little bit specific because it has happened to their child specifically, but it should, I believe, probably affect quite a few people. Their child was diagnosed with sensory dysfunction in some areas, visual and hearing.
Mm-hmm.
Now, is that a subcharacteristic of ADHD, or would you say that's a main impairment on its own?
Sorry, an impairment with actual, are we talking about auditory processing, or are we talking about just hearing?
They mentioned a sensory dysfunction in regards to visual and hearing specifically. Um, Actually, if that audience member would like to.
Well, again, sensory issues is something that can be another disorder that frequently occurs with ADHD. It is not generally something that is part and parcel of ADHD. But what we have to remember about ADHD and a lot of these disorders and the kids is ADHD almost never comes cleanly. And a lot of these kids are, we frequently use a term called in the syndrome mix. So children with ADHD can meet the criteria for ADHD, but have some Asperger's type symptoms. They can have a little OCD symptoms. They can have a lot of other things going on. They may not meet the criteria for the diagnosis of some of these other disorders. But we know that a lot of these disorders are sort of a bit of this and a bit of that, and they have to meet a certain criteria for diagnosis, but a lot of these kids have a mix of a few different things.
Okay, so another question on the note of that we mentioned different therapies. Do you find in your experience of even just working with children that have ADHD that oftentimes, or maybe very rarely, that children actually outgrow it?
Okay, so as we said in one of the slides, that we know that from studies that at least 2/3 of the kids, when they become adults, still have impairing symptoms for ADHD. The other third, we're not actually sure of, do they totally outgrow it? Does it go away? Usually not totally. Do they teach themselves coping strategies? Do they learn, tricks around organizing themselves and refocusing themselves, in a way that it is not as impairing anymore? Do they get into a job and occupation that works to their strengths rather than their, weaknesses? There's also some kind of unique good things about some people with ADHD. A lot of energy, thinking out of the box, a lot of entrepreneurial skills, that type of thing. So for some people, those things become strengths and benefits. So we don't really know that, do they actually outgrow it and does it totally disappear? We think that a lot of it is sort of compensation. We know that what does get decreased significantly is that outward hyperactivity. So you very rarely, I mean, you don't see kids in high school running around the classroom and jumping on desks and that kind of thing. But frequently adults talk about it as being this internal, this constant internal restlessness, like they just can't shut off the thinking and the motor in their brain, and that's why a lot of these kids and adults find it very, very difficult to go to sleep as well.
Oh, right. Okay. Um, Now we have somebody asking, are children with ADHD, of course, it helps to take away a lot of the distractions around them and beginning to really get them on a path of focus. But is it recommended that they learn in specific environments like homeschooling or like a Montessori setting?
No, actually not. You know, there's a lot of accommodations for ADHD that can be put in place very well in a regular classroom, and most of these kids can do quite well in a regular classroom stream when there's small things put in place. So sometimes positioning of the desk, you know, yes, you don't want to sit them right by the door where they're going to hear and see everything, that type of thing. You know, reviewing instructions, chunking their work with them, having a homework buddy to make sure, you know, there's help in getting the books in the backpack, all these type of organizational skills. You know, the recueing by the teacher. Now, so there's a lot of accommodations that can be put in place. Actually, Dr. Tanner just spoke about this Tuesday night in a session I was in with her, where she said there really isn't any evidence that a small classroom or private schools benefit these kids. Now, what does benefit them is these accommodations and strategies being put in place. So that being said, wherever you can have that happen is would be the best scenario for that child.
Okay, so it's almost more focusing on tailoring the teaching than rather the environment.
Exactly.
Okay, perfect. So, actually, on that note of teaching, we have somebody asking, is it um, kind of overcomplicating things for a child that has ADHD to want them to, or to push them towards learning a second language?
You know, that depends on the child. We've had a lot of kids who've been in French immersion streams that have had to be taken out because when you have difficulties following instructions and all that type of thing, doing it in a second language can add a whole nother layer of complexity to it.
Mhm.
But, you know, we've had some other kids who've done okay. So I think it really depends on the child. If you have a child with ADHD and they're in that type of educational system and you see them struggling, it may actually be something you may want to reconsider. The other thing is a lot of times French immersion type programs don't have as much special education assistance and help. So that's something
Right.
to consider as well.
Okay. Um, Now we have a question from a teacher actually, and this is great. And I hope I don't mean to put you on the spot, but have you come across any books at all where there has been characters that represent maybe a child with ADHD that is successful and is almost a hero of a story at all?
Good question. You know, not really. There's a bunch of books out there for kids with ADHD that you know tries to inform the child about ADHD, and then they have characters, you know, that have ADHD and they talk
Hmm.
about their own ADHD, but not really a story or book where the hero or heroine has ADHD. Actually, if anybody finds one, I would be very interested in knowing the answer to that question.
Awesome. If anybody in the audience knows of one or does come across of one, let us know, and we'll definitely make that a public resource. Um, Now, actually, we have some coming in, some suggestions here. Um, Actually, some people are in the audience are saying they're going to get to writing one.
Okay, good idea.
Now, in regards to looking into specialists, to having diagnosis, or to dealing with therapies after the fact, do you know if, as Canadians, there's any financial support available to do so?
No, and you know what? This is a huge issue, and we actually talk about it in the socioeconomic paper that many of the treatments for ADHD, other than seeing a developmental pediatrician or psychiatrist or child and adolescent psychiatrist and getting the assessment and the medication prescription, if you choose to go that route, all of the other things like cognitive behavior therapy, tutoring, ADD coaching, a lot of this other stuff that we know is quite beneficial, even just education and training for the parent, is very difficult to access, and it is frequently at an out-of-pocket cost. There are some hospital clinics that have a few of these programs, but they're usually short-term, and they're usually for, say, parents who, you know, have great difficulty with parenting and the kids are quite severe. Other than that, most of these things are accessed through psychologists, social workers, ADD coaches, tutors, and all of that is out-of-pocket cost. And we make this point in the paper that what happens is we end up with a two-tier healthcare system for ADHD. So those people who can afford all of these things obviously end up getting better ADHD care than those that can't.
Oh. Actually, Heidi, can I bother you maybe to switch back, if possible, to that slide where it shows the link to the paper, just so that everybody can
Sure, there
access
you
that?
go.
Awesome. So if anybody is looking again for the link to that paper that Heidi just mentioned, there is a link at the bottom of that slide to access the ADHD Awareness Week site with a lot of great resources. We do actually have quite a few audience members letting us know that the Percy Jackson series of books has main characters that are heroes that have ADHD and dyslexia. So that's the Percy Jackson series of books for anybody else looking for those as well. We've got quite a few people recommending those.
Okay, great.
There's also one called Corey Stories as well, a kid's book about living with ADHD. So those are a couple recommended ones, I guess, if you are teachers out there looking for ways to portray ADHD to your students in a positive way for them to understand as well. Um, we'll get to one more question here, if you don't mind, Heidi.
Sure.
Just gonna pick the greatest one here that we have left. Let's see. So you mentioned, I know at one point, about sugars and like a sugar-filled diet not being
Hmm.
an actual, well, of course not like the best thing, but that it's not an actual reason for ADHD.
Right.
Um, so I've had a couple people ask or have recommendations from their doctors and friends that a gluten-free diet actually could have an effect on ADHD symptoms. Has that been something that you found at all?
Okay, well, what research has told us is that exactly what you said, you know, where nobody's recommending a high sugar diet, a good balanced diet, high in protein is good for brain functioning in general, as is exercise. We know exercise can help with focus and attention. It just gets the blood flowing, you know, in the brain. So all those things are good. Diet-wise, you know, the only thing, sort of supplement-wise that is shown a little bit of positive stuff is omega-3s, and that is shown very minimal for more the primarily inattentive type of subtype of ADHD or reading disorders, and again, very minimally. As far as I know, there's been no research on gluten-free diets in ADHD. What I will say, though, is that what happens with ADHD is there's a lot of things that we as humans and children can find very irritating. So if you've got allergies, if you've got hay fever, and your eyes are watering and your nose is running, and you have ADHD, if you treat the hay fever, the inattention and distractibility will go down just because the annoyances of that and the distractions are decreased. Doesn't mean it's actually curing the ADHD, no, but it is helping, with the symptoms. So obviously, if you have certain digestive issues, certain other health care issues that are affecting your body and its functioning. I mean, we all know that when we're in pain, when we're not feeling well, our attention is going to be less. Well, that happens with everybody. So the more we can treat these other things and have a well, healthy person with ADHD, the better we are. Does this cure ADHD? Research is telling us at this point no, but again, it's good to look after those things as well.
Perfect. Great final question there to end that one. So to everybody that is still pouring in with their questions, Heidi, everybody's really wanting to pick your brain with so much here. But I will let everybody know we will have Heidi back with us mid-month in November. She had mentioned it on the middle of the call, and a lot of people are looking for more information. So our next webinar will be addressing how ADHD really appears in the classroom, and that's more of the impacts on the learning and how it's will affect student achievement, covering organization skills, time management, just some really effective strategy and just pointers really regarding everything in the classroom. So it's perfect for teachers and parents again, everybody that has school-age children that may be encountering the ADHD symptoms. So if we could have everybody join us again in November, that information will be posted further on our Facebook page and on our main website. Now, before I get to more details surrounding that, we will do the Scholar's Choice draw that I know a lot of people are waiting for on the line as well for the $100 gift card. Just as a reminder, to be in compliance, this draw is open to Canadians in provinces except Quebec, and there will also be a mandatory skill testing question to follow. So if I do call your name, I'll just record your email and send you a follow-up with our prize waiver sheet. So if we can have a virtual drum roll. Going to pick a random name from the audience here. And I really hope that I'm pronouncing this right. The winner is Michelle Ekelenkamp. I believe that's how it would be said. Michelle Ekelenkamp. If you are hearing this loud and clear, that would be awesome. I'll get in contact with you. So Heidi, I just wanted to thank you so much for being on this call, and to the whole Centre for ADHD Awareness Canada for their continued support in our advertising and actual occurrence of this event. A reminder again to everybody that Heidi will be joining us mid-November for that in-depth look at the classroom impact of ADHD. And if you found this webinar to be valuable, feel free to visit community.scholarschoice.ca for more great educational articles on topics like this. And that is also where this specific webinar recap will be available next week on Thursday, October 24th. It will be available within a blog post on that community page, so everybody can access all of those slides. They can view it all, listen to it again, and share it with friends and family. Now, Heidi, I know that you had flicked over to a page that had the contact information for CADDAC. I don't know if it is still
Yes.
perfect, so everybody
This is,
can.
yeah, this is the resource page for the CADDAC website and the ADHD Awareness Week website. And I'm glad you mentioned that, Regan, because I was going to let people know that, I mean, obviously there's a lot more questions out there, but this website is just a fabulous resource. If you do go to the question and answer session, chances are you may find your question answered there. The film presentations that are there are great. There's a couple that I don't know if somebody's gotten in and corrupted them, but we will be working with them in the near future. To correct those and get those up. But a lot of your questions you can find answers to on the website. And I would also encourage people to come out to the conference. I know a lot of people who come out say just the atmosphere and being with other parents and teachers, they just learn so much from the networking and the sharing of ideas, and of course from the medical experts who are presenting. So there's lots of information out there, so please access it.
Absolutely. Yes, I'm so glad that we could actually highlight during ADHD Awareness Week as well that that resource will be available. So if anybody wants to check more out concerning the conference, just like the link Heidi mentioned at CADDAC, and then there's also the ADHD Awareness link as well. And now we will all make this available on our site as well. I will post it on our Facebook page this evening, just in case anybody is missing these links. So, on that note, you can join our Facebook community for Scholars Choice. That's now over 8,000 members, and that's facebook.com/scholarschoice.ca. So, we'll always release our great new content there. We'll inform people to join us on these webinars in that portal. And if you have feedback about this specific webinar, we'd love to hear it on our Facebook page when you get the chance. So, and Heidi, CADDAC has a Facebook page as well, correct?
We do. CADDAC has a Facebook page, and there is an ADHD Awareness Week Facebook page as well.
Perfect. Awesome. So I will make sure everybody has those links on our Facebook page this evening.
Great.
So on that note, Heidi, is there anything else that you would like to cover concerning ADHD Awareness Week, or anything you?
No, again, I would just really like to encourage people to go to the Awareness Week website and spend, 20, 30 minutes looking at the template letters. Really, that's all it's going to take for you to add a little bit of your own information, send it off to your MP, MPP, because we can't do the awareness and advocacy work on our own. When we go to speak to the politicians, they basically say their constituents never talk to them about ADHD. Why should they be interested? But we know from these sessions and the calls we get day after day with people who are frustrated about the lack of resources and awareness and, information out there, that there are many, many, many thousands, well, there's over 1 million people with ADHD in Canada, that it is of interest. So let your politicians know that it interests you.
Absolutely. Perfect. Thank you so much, Heidi, again, for sharing that all the wealth of information that you have tonight. And thank you to everybody on the line that has joined us this evening. So on behalf of Scholars Choice, thanks again. We hope to see you next month, and that you are leaving this call feeling just really inspired and empowered now to parent and grandparent and teach children with ADHD effectively. So good night, everyone.
Hey, good night. Thanks so much for this opportunity, Regan.